Robinson. Good afternoon.
All right.
You're fine right there.
Okay.
Today,
How are you doing?
I'm doing well. I was glad to see you back here with us. We didn't
Yes.
scare you away from last time. So we've already got all your history and stuff from the questionnaires that we did last week. This week, what we're going to do is a focused assessment, and I'm going to do a respiratory assessment. I'm going to visually inspect your lungs first, and then we're going to also listen to all the fields and see what your lungs sound like. Have you had any trouble at all with asthma or COPD or anything in the past? Any significant breathing limitations?
No.
And you're working inside, correct? So the quality of air that you get pretty much on a regular basis is consistent?
Yes.
Okay. All right. I'm going to start off first visually and just inspect the chest. Want to make sure you don't have any barrel chested. This is what we call when the chest becomes rounded. A lot of times you'll see it in COPD patients.
Okay.
And you also want to look at mid-sternal region too and make sure there's no funneling. Kind of like a line going down the chest. And certain breathing conditions causes these types of things that you can visually see. And also, slide towards me turn around towards me for a minute. I'm going to take a look at your fingertips. And this is what we do to see how well your extremities are perfusing. It should take about 1 to 3 seconds when I press down, and the color should come back to them. It should go from the blanchable redness back to the normal color. And it looks good. And look for clubbing of the fingernails also, which is a sign that if a person isn't perfusing or getting the proper amount of oxygen, you'll see clubbing of the fingers. Again, it's more typical in COPD patients, people that don't get the proper oxygenation on a regular basis that they need. But you don't have any history of smoking. Everything looks good. Excellent. And also what you would like to do is, I'm going to kind of pretend that I'm getting your pulse for a second, but all the while I'm going to be looking at her respirations and counting the number of her breaths, seeing the rise and fall, making sure everything is symmetrical on both sides of the chest and the back as well. So you don't want to let your patient know that you're counting their respirations, because some people tend to overcompensate or kind of adjust to what they think it should be.
Exactly.
So I'm just going to kind of glance at my watch for about 15, 20 seconds and get a number. Our normal breath should be between 12 and 20 a minute. Let's take a few seconds. All right, relax. Okay, so she said anywhere between 14 and 16 respirations a minute. Normal is 12 to 20 again, so I don't see any problem there. And now we're going to move on. I'm going to also take a listen to your lungs.
Turn around.
Yes, ma'am. And what's important to remember in this is that the right lung has 3 lobes, and the left lung only has 2.
Okay. So
I want to start at the back and listen in a Z formation. I'm going to get you to take some nice full deep breaths in and out for me. Excellent. And you want to go on a Z pattern, deep breath. All fields are clear so far. And then for this right side, I'm going to go just at the level of the last rib here and get her to take one last deep breath for that 3rd lobe of the right lung. Excellent. And stay seated where you are. Also listen anteriorly as well. And deep breath. And one more. All right, excellent. I can tell you never smoke or sound so good. You want to take note if there's any rhonchi, which is low-pitched thunderous sound. So there's no rhonchi, there's no rails, there's no wheezing. All fields are clear. And Ms. Robinson her lungs sound good and healthy. Like I said, she's never smoked, so this assessment is pretty short and sweet. She doesn't have any underlying lung imperfections or anything going on with those. And also what I would do ideally, and I don't have one here with me, is you will want to place a pulse oximeter on pretty much any finger of the patient, and that measures the oxygen saturation at your peripheral extremity. So you want to see that to be anywhere between 92 and 100. At our hospital, what we typically do is anything under 92, we go ahead and put oxygen on the patient, and then let the doctor know if they don't already have an existing order and to titrate oxygen. Definitely don't want to play with that. But I'm pretty sure all signs point everything is good with you. And hopefully this has been informational for you guys as well. And if you have any feedback, I'd be happy to take constructive criticism and just let me know. All right, I appreciate it. Thank you.